But medicine is an ever-changing subject. Today, whatever you are thinking that, just to check this, there are next level teams for us. Any organization, the quality of service, how do you measure? Anybody says, my service is the best service, correct? If you take a star hotel, they say that my service is the best. Now, how do you measure that? The measure is done by, number one, the quality standards, whether they are fitting into the quality standards. Second thing is output measurement, customer satisfaction, correct? So for an ICU, how do you measure? There are already international standards for any ICU for that matter. There are inputting quality standards, there are output related quality standards. So I will give you some examples. For an ICU, the inputting parameters are like whether there are around the clock the team, doctors and nurses, whether they are there or not. Number two, when a patient is received, once they start treating the patient, that whole treatment is a baton exchange. Right? Doctor says something, nurse will follow that, and she has to send the investigation. That investigation has to come in time, and then you have to interpret that, and then change the treatment or escalate or de-escalate the treatment. Right? And when a patient comes, immediately how do you resuscitate the patient? We call it door to needle time. Okay, so these are all inputting parameters. But these, if somebody is complying with the international standards, the quality is correct now. But in CIPACA, we measure all these things. Because the whole team is trained in that, we can measure all these things very clearly and correct it. Just to check this, there are next level teams for us. There are cluster level teams to check that. Number two, okay, fine. You have got a team who is ready right now. But medicine is an ever-changing subject. Today, whatever you are thinking that current or the process to be done, next year it may change to the next level. Correct? So someone has to keep an eye on that and then keep on educating people to ensure that they have that top-notch, cutting-edge technology and the knowledge in managing the patients. Correct? So we have another team for that. So all these things put together, they check the input parameters. What are the output parameters? Okay, fine, and manage the patient. So number one, patient should be happy now. So that is why we measure patient satisfaction. That is the most important thing for us, customer satisfaction. Currently, people are there thanking and going because you are touching the, I would say, rural population, right? Where there is no other option for them. You are managing them. Of course, that is one side of it. Second is technically how do we measure? Very simple. There are output parameters, like how many people are getting infections in the hospital. Okay, if the number is less, the quality is more. And there are many other indicators like survival rate for that matter. Okay, so how many patients are actually getting saved, right? So when an organization is constantly measuring all these things, correcting itself, in any organization, big organizations, you have this PDCA cycle, right? Even in ICU, it holds good. Plan, do, check, act. So when ICU is launched, we have planned. ICU is launched, that is planning and doing, and constantly checking and correcting. Now, once someone is following all these things as per the prescribed international standards, and then you are measuring it and then recorrecting it. Or don't you call it quality care, quality standards, quality norms?